Okay,
Yeah.
teacher.
Okay, Edwin, let's start.
Okay. Hello everyone. I hope that you are very fine. ¿Tengo que grabar? Oh,
I'm recording right now.
okay. Hello everyone. I hope that you are fine. You're great. And the topic for today is about the cause and treatment for OCD and anxiety. That is the webinar for today. I am the first piece of the webinar, so I'm going to begin. Well, firstly, I want to explain what is anxiety. Many people know the word that anxiety is commonly misinterpreted, but in this case, anxiety is the meaning of anxiety is related with the nervous, frustration, or maybe a little depressed. But in this case, we can relate it if it is not a diagnosis or if it is not an illness. It's a common emotion or feeling that for the daily life. For example, you are working hard, you are having a hard day with the studies at the university, and then at one point you will feel anxious, because you feel nervous, you feel frustrated for the daily life, right? This is a common symptom of the response of the daily life. But when it becomes an illnesses, well, when it becomes an illness, it becomes an illness, a real symptom or a diagnosis when you experiment this every day, every second, every minute. For example, there are many people who suffer from, for example, about thinking or nervous or frustration every day. There were no specific day that people or that person can feel relaxed or maybe in peace, right? In that way, when you feel or experiment this illness every day, that is called anxiety. But this anxiety is related with a diagnosis, with a real illness. And what are the symptoms, the common symptoms or anxiety illness, the illness of anxiety? What are the symptoms? The symptoms are, for example, high pressure or blurry. You are shaking your hands because you feel nervous, you feel anxious. Also, you cannot breathe very well because your high pressure in your chest is just pushing up your pressure, and you cannot breathing very well. Also, you cannot, for example, you cannot go out like a normal person with their family, with their friends, because that person is just feeling all the symptoms I have mentioned. Now, how anxiety is related with OCD? That OCD is a illness, is a dangerous illness that is caused by intrusive thoughts. The doubts that ruminate in your mind, pop in your mind. Sorry, someone's have the microphone on, Maria del Mar.
Sorry.
Okay. That illness is Giselle. Giselle to have the microphone. Giselle? Okay, thank you. This OCD, that is obsessive compulsive disorder, It's a kind of illness, a mental illness that is related to intrusive doubts. You know, that overthinking about one see a specific situation, an event, a match, emotion images that come in your pop in your mind every time. Negative doubts just come in your mind every time, just make you think that you are a bad person or a disorganized person, a negative person, a destructive person. That is a kind of doubts that enter in your mouth, enter in your mouth or get in your mind and try to tell you you are the worst person around the world. You are just an invaluable person. That's the common doubts that get in your mind. And that's why people suffer every time just trying to get rid of the doubts from their mind. Now, what are the common causes for this mental disorder? For example, in this case, OCD is related with a frustration. Like I told you before about anxious, is frustration, nervous, the hard day that you are having every time, every day, like a routine. For example, you are having a hard day of working every day, and that becomes a routine. And that routine, when you combine them with a bad habit, for example, smoking or drinking alcohol, watching porn, that that is the beginning for the first doubt you will, or the first or the second or third doubt you will be thinking in that. And I, I want to tell you that the frustration of the daily life is just the cause for active the doubt that is, and the doubt is related to bad habits. For example, if you are smoking, like I told you before, you are smoking, watching porn, that is negative situations or negative habits that become in doubt that get in your mind and trying to tell you something like, for example, if I am watching, if I am smoke drugs, if I am addicted to drugs, you know, drugs are related with bad things. For example, you have to kill your friends. If my friend want to kill me, I want to kill my friend. If my mother tell me something bad, I have to hurt her. So it's just this kind of response from what you think. Is if you are, that is a kind of active situation when you think in one thing, and when you acted with the hard day, with the hard life, you acted this doubt. That doubt came into your mind, telling you that you have to do what the doubts wanted to tell you. If you want to kill your friend, you kill it. But you don't want to do that. You don't want to kill your brother. You don't want to hurt your mother. That is the doubt want to tell you. Kill your mother, but you don't want. And how can you treat that? How can you treat that? And it's not only about killing or murdering, or it's also about sexual behaviors, belief, religion, and every kind of topic, right? But in this time, we focus on that, right? But what is the treatment? What is the treatment for getting these doubts out of your mouth, or try to let not to think in those doubts, or make that doubts appear in your mind? How can you do that? There is a treatment for this. There is a treatment for this mental behavior. The first thing you have to do is trying to get a counselor for getting information about your problem, because many people that suffer this kind of illness don't know how to treat, or they don't know what is that illness or what is the meaning of that illness, or not get in touch with that the meaning of that illness. So now when they get a counselor, then the counselor will guide you, or they lead you to a psychiatrist. The psychiatrist give you medicine and therapy, physical therapy, called the physical therapy. The common physical therapy is
Wait, one more minute because your time is over.
Okay, 1 minute, 1 minute.
Okay.
The one is physical response, and the other is medicine. Medicine commonly referred to anxiolytics, or, for example, sertraline, sertraline is clozapina, risperidona, and that medicine can help you to overcome your situation, your mental situation. And the therapy is also commonly a good medicine, you know, to help you to get rid of the doubts and go on with your life like a normal person, right? That's all I have to say. I hope that you can understand this topic. And someone want to ask me questions?
Thank you, Edwin. You did a great job. So each one of you will ask something about his webinar. Let's start with Maria del Mar.
The question for Edwin. Can you hear me? Good?
Yeah.
Guys, tutor? Yes, hello.
Yes, I
Okay,
can hear you.
Yes.
So what coping strategies can I use to manage symptoms in my daily life, according to the topic?
Yeah. One thing you can do it is meditation is a good tool to breathe, to be conscious of the present. It's also called mindfulness. Is related to mindfulness, meditation. And the idea is that you can breathe, take a breath, and be conscious on your breathing, and that way you can be in the present, and your doubts will disappear. It's like a I don't know, like a mechanical or like automatic thing that happen in your mind, that when you do it, when you do meditation, you can do doubt, get it off in your mind. Your daily life will be as normal as possible. Yes.
Okay, Edwin, thank you.
Thank you. Okay, Juranis.
Hi, teacher.
Hi.
Edwin, mental disorders affect people's learning?
Yes, obviously, yes. Because you are able to think, overthinking, and you will be overwhelming for that situation, because you are you are having you are being frustrated, and being nervous all the time, thinking in the same doubts, ruminations popping up in your mind, and you cannot do your things at home. For example, if you are a mother house, if you have this mental disorder, obviously that you cannot watch the plate, you cannot watch TV, or you cannot clean the house, because you are able to think in that situation, and in that doubt, or in that situation, may you cause feelings. For example, you can feel like you want to suicide because that doubt not let you be your what you are really are, and that's it. It affects you. It affects you, your life, your and your learning also. Your learning. Sorry, you are talking about learning, right?
Thank you, compañero.
Yes, the learning is
Okay,
affecting too. The learning is affecting
Giselle,
too.
excellent, Edwin, and
Okay.
I
Hello,
think
Edwin.
only Jennifer is missing, or also Giselle too.
Okay. Hello,
I'm here.
Edwin. For the question, so what are the biological and environmental factors that contributed to the development of anxiety and obsessive compulsive disorder?
Yeah, I got it. I got it. It doesn't affect directly in your behavior or in your neurons. Maybe the possible is that when you breathe or you hear the lot high noise, a lot of noisy out, for example, the noise of cars, the noise of buses, just you will feel frustrated, and your thoughts can come in your mind again, and you this is an active uh, um, this is an activation from the illness, right? It can affect you in some way. And other thing is, for example, uh, when you smoke or you smell the smoke of someone, you can be in all the smoke, and you will be having a stress, so stressful to smell that color, that sorry, um, that smell, that becomes frustration for you. Something that cause you frustration, that lead you to develop or to active your doubts. And that doubt, may catch you negative emotions or these symptoms that are normally appearing in this illness. Yes.
Okay, and Jennifer is the last one.
Okay, Edwin, can a person who suffers from some of these mental disorders recover completely or no?
Mm. No, no. The illness doesn't disappear. The people who has OCD doesn't disappear because that is there are many researches, investigations. I investigate a lot about that. It says that you cannot overcome the illness, but you can overcome the symptoms of or being want to be suicide. You want to be you want to be frustrated or afraid of that doubt, that there are treatments for just release or get rid of the doubts, and your life will be so normal. And but your illness cannot disappear, never. But you can treat it, and that's kind of overcoming uh, achieve that you can have when you practice the treatment and the medicine. That's why you have to take the medicines, and you can have the treatment for that symptoms, right? That's all.
Thank you.
Okay, thank you, Edwin. You did great. I'm gonna stop the recording right now.